Hi, my name is Geraldine Gordon. I'm one of the Clinical Midwife Specialists here in lactation. I work in the department with my colleague Marina, and our role throughout the hospital is to provide support and to promote breastfeeding. And this job involves helping mothers, women antenatally and postnatally to have the best breastfeeding experience they can. And it also involves educating staff to support them in their role in delivering care to our new mums when they're trying to breastfeed their baby. So in answer to the first question, breastfeeding can be a challenge for all mums. She has to get to know her baby has to get to know her. So it's good not to worry too much beforehand. Until you have your baby in your arms and you put the baby to the breast, you're not going to know how things are going to work out. Remember, every time a baby goes to a particular mum, it's your individual baby and it will learn to adapt to your shape and size. So I wouldn't get too stressed out. There are different tools and different techniques that can be used to overcome different situations. So it's a very individual basis. So if you're worrying about what might happen, just wait until you have your baby in your arms, and particular situation, the staff will help to support you, and we'll see how things go. Okay, for some women who have underlying medical conditions, the use of breast milk is not suitable, or they know that their body may not have the ability to actually make enough milk for their baby, or that they're on medications that are detrimental to the baby. So for some women, they make the active decision that they can't breastfeed, and they know from their pregnancy or from their antenatal history that it's not going to be a factor. For other people, sometimes it's just a lack of information, that they don't realise that the benefits of breast milk are so important, that there is a big difference between the components of breast milk and formula milk. For example, breast milk has roughly 350 different components to it. Formula milk has about 150 components, so there's a huge difference, and there's a lot of goodness in breast milk that can never be engineered or made. So breast milk is always going to be superior. And as health professionals, it's our job to ensure that we are promoting what the best form of nutrition for babies. That's why we encourage breast milk. Now, if mothers have this information, some of them just choose to give formula milk because it's more convenient, or because culturally their families before them have always been bottle feeding family, and they don't know any different. But we're hoping going forward, we're constantly working to try and promote the importance of breast milk, particularly for our vulnerable and sick babies that end up in the NICU, in the neonatal unit. So for those mothers, sometimes even though they choose not to breastfeed, when we explain the importance of the breast milk, it's a valuable medicine for babies. Some of these mothers will opt to try and give breast milk to their babies instead. So it's a choice, and we respect the notion that it's every mother's choice, but our role is to try and make sure that we give enough information to our clients during the antenatal period to allow them to make an informed decision about how they want to feed their baby. And partners play a big role in this. Sometimes, you know, some mothers may feel under pressure because their partner wants them to breastfeed, or their partner doesn't want them to breastfeed. So this is a decision that parents must come to together. So we just hope that we can arm them with the information to actually make an informed decision to feed their babies. Okay, throughout the antenatal period, from the very first booking visit, it's hoped that every opportunity will be used to get information about infant feeding. So from the booking visit, staff will begin to talk to you about the importance of breastfeeding, the benefits of breastfeeding, and every time you have contact with a healthcare professional, please use the opportunity to try and get more information about breastfeeding, and give yourself enough information to find out how we can help you along your journey. But throughout pregnancy, you should be getting more and more information about our practices and what we do to help you become a successful breastfeeding mother.